Hello, good morning. Today we are going to discuss muscles of the face. In that, muscles around the nose. Mainly there are four muscles: procerus, nasalis or compressor nares, and depressor septi and dilator nares. In dilator nares there are two muscles: anterior dilator nares and posterior dilator nares. The procerus muscle will originate from the lower border of the nasalis muscle and the upper border of the nasal cartilage, and the fibers runs upwards and insert into the eyebrows, skin between the eyebrows and the frontal belly of the occipitofrontalis muscle. Now coming to the nasalis muscle or compressor nares muscle. It has two parts, one transverse part and another one alar part. The transverse part is originated from the superior lateral to the incisive fossa, which it's the fibers runs upwards and medialward and inserted into the aponeurosis of the between the two nasal bone which crosses the bridge of the nose. The alar part is originated from the superior lateral to the incisive fossa and inserted into the greater alar cartilage. Now coming to the depressor septi muscle, which originated from the incisive fossa and the fibers runs upwards and inserted into the nasal septum or back part of the alar part of the nasalis muscle. Now coming to the dilator nares muscle. As previously discussed, there are two dilator nares muscle which are anterior dilator and the posterior dilator nares muscle. The anterior dilator nares muscles is originated from the greater alar cartilage of the nose and inserted into the integument of the nostril margin. And coming to the posterior dilator nares muscle, which is originated from the lesser cartilage of the nose and inserted into the integument of the nostril margin. Now coming to the actions of the muscle. First one, that is a procerus muscle, which drag down the skin of the eyebrow. Between the eyebrow skin, it drag downwards and makes the wrinkles over the bridge of the nose. The action of the nasalis muscle or compressor nares muscle is it depresses the cartilaginous part of the nose and draw the alar toward the septum. And the action of the two dilator muscles, which it enlarges the aperture of the nose or nares. And action of the depressor septi muscle, which it depresses the cartilage part of the nose and draw the alar towards the septum.